So I'm going to kind of, I've prepared, some things to talk about, and I will talk about those things, but I'm going to try to do it in a little bit less of a speechy way. I'm going to try to, talk a little bit more in an ad hoc way, and then hopefully invite a little bit of conversation if we have a few minutes at the end. Jennifer and I were brainstorming about some different things that I might talk about given the content of this conference about, best practices and all that sort of thing. So we talked about some of the usual possibilities, impact and sustainability and scale and all those things. And I think I will touch on those things in different ways throughout the course of my talk. But I'm going to go a little into left field. You can tell by my background I haven't really followed a traditional career path. And so I'm going to talk about three things that might not seem terribly connected to you. One is I'm going to talk about science fiction. Two, I'm going to talk to you about the biological concept of emergence. And then three, I'm going to talk to you about the Sierra Madres in Mexico. And somehow all of that is going to connect into the theme of what I wanted to talk to you about, which is this idea of managing uncertainty. What do you do when it's not really clear what you should do? I've sort of found over and over again that that's where I find myself, and so I figured I know that experience best. I'll just talk to you about that, and we'll see. Maybe there'll be a few things that you'll find helpful. So science fiction, why am I going to start there? Well, so as Jennifer mentioned in my bio, I have a PhD in comparative literature from Vanderbilt University, and so when I was studying there, I ended up studying not, sort of cool science fiction like cyberpunk or, something modern like that. I actually studied the history of science fiction, and I went back and I read and studied a lot about the Renaissance and early Enlightenment period, and I was reading a lot about the introduction of the new science, modern science sort of mentality into Western thought, and looking at the literature that responded to that. And strangely now, as I look back, that really was my first introduction at an intellectual level to this idea of uncertainty and how people respond to the opening up of possibility. So just to kind of remind you, I'm sure you all have this down, but in any case, I will just sort of remind you a little bit about the history. So for, a millennium and a half, Christian thought had dominated the Western way of understanding the world, right? Religion was how you understood the world, including the natural world. And so in the mid-16th century, Copernicus speculates that maybe the Earth is not the center of the universe. And in the early 17th century, Galileo confirms that by direct observation. And in the decades that follow, there's this just huge opening up of possibility and a great amount of uncertainty introduced into the way that people thought about the world. And it was, sort of scary on the one hand, right? It's a very decentering. The universe is not coherent. It's kind of fragmented. How do we make sense out of it if God hasn't just ordained everything as it is? But at the same time, it's very exciting because it really does mean that there might be new ways of understanding things. And so in looking at the literature of that time, you can sort of see people beginning to play with various ideas of not just the natural world, but actually our social world as well, and how we construct it. And I will try, if I can, to come back to that a little bit at the end. So for me, as I look back on it, science fiction is actually similar in a weird way to social enterprise, because there's this process of imagining things as they might be, rather than simply accepting, well, this is the world that we've been given and we're just going to live in that. So that was sort of my first introduction intellectually to it, although I had no idea that it would end up in any way informing the way I thought about how I did my work. When I left Vanderbilt, like any good PhD student in comparative literature, I couldn't find a job. So I took a job in the nonprofit sector. First, I worked as a curriculum director for a little while, and then I ended up leaving that to start this national, very small network of national nonprofit organizations called Community Impact. So it was based on a model that had been started in Washington, D.C., and then what we were going to do was expand it nationally. So again, I really didn't know what I was doing. We took this program that had been successful, and my role, I was sort of the program guy and the expansion guy, and the goal was to try to take that and start it in different cities. So we started in DC and we expanded to Baltimore, Austin, Texas, and Nashville. And I was flying around and trying to find executive directors and help them get the organizations going and build the program and adapt the program from DC. And at first, what I did was, I wrote manuals, and we standardized the program, and we kind of had all the rules of how it had to go. And then, as you can probably imagine, I had no experience really managing nonprofit organizations. I had no experience working in low-income communities or communities of color. And I didn't have a business background, I was a comp lit guy, for God's sake. It was sort of crazy that I was doing this. But you learn quickly on the job. And one of the things that I began to realize early on was that we couldn't overprescribe the programmatic elements. Each time we tried to say, like, you have to do it this way, this is the only way to do it, the guys in Nashville would be like, yeah, but that's not really like going to work here. We've got to change it this way or that way. And so, you gradually start to learn at a programmatic level about how to pare things down to sort of core elements, and then also make sure that you're adhering to a set of values that become a kind of guidepost for you. So there was that sort of programmatic, how do I shape things when I think I know what I'm doing, but it's not always clear that it's going to work in this new context, and you have to stay very alert as you do that. And of course, the other thing I was learning all the time was, how do you build an organization? Watching the different leaders and how they succeeded or failed, how they built their staffs, how they built their boards, how they thought about fundraising. All those things are, it's incredibly challenging to figure out how to structure things when you're starting, from scratch, even when you have a base to go from, like we did with Community Impact and a sort of model to start with. So, during this time, I also, because I was doing so much of this, I took an interest in supporting other nonprofit organizations that were also in this early stage. And so, again, as Jennifer mentioned, I got involved in advising a number, and have done, advising a number of startup nonprofits. And you start to see similar sorts of things. There's a lot of lack of clarity of, like, how are we going to pull this off and how are we going to sustain this? And again, I think, one of the themes that I'll come back to as I talk a little bit more about some of the principles is that need to just, constantly be adaptable and have that capacity to sort of shift gears, not off the long picture, but off some of your short-term strategies. Another really important experience for me was when I left Community Impact and took the job as the Dean of Admissions at Bennington College. And you can sort of see the theme emerging here of, really? You have no experience at that. How are you going to be a Dean of Admissions? And Liz Coleman, who is the former president of Bennington and who was crazy enough to hire me, just said, you'll figure it out, it's fine. You know the core stuff. And eventually she was right, although in the first 2 years I think she probably had her doubts. But the thing that Bennington, in addition to just having to deal with my own personal sense of not knowing what I'm doing and having to get on a very fast learning curve, the other thing that Bennington taught me was really profound, and that had to do with the structure of the educational model at Bennington. I don't know how many of you know much about Bennington, but it's a small liberal arts college in Vermont. It was the first progressive college in the country. So back in the early part of the 20th century, when Dewey and others were doing all the education reform, most of that was focused at the schools, right? All the way through high school, but not beyond. And so there was a movement among, sort of educators that there was a need for a progressive model at the college level. And so Bennington was founded by a bunch of professors from Columbia, Williams, and others who conceptualized a much more open way of learning. So Bennington has an open curriculum. It was really the first, it was an all-women's college, right? So they figured, it doesn't matter, we can experiment because it's just women, right? And they did dramatically. They introduced the arts into a liberal arts curriculum. They brought faculty in that did not have PhDs but were practitioners, and they had this model of an open curriculum where students really had to design their own majors, their own pathways, academic pathways, in close consultation with faculty. And when I got to Bennington, you know, I saw the power of this educationally. It was not always easy to sell to parents, interestingly, but it was incredibly interesting to see why it was so powerful. And I think that, you know, what it taught me is this balance between structure and chaos, right? So you're sort of always trying to provide just enough structure that people have a sense of orientation. They sort of know where they're going. They can locate themselves on a landscape, but it doesn't tell them where to go. It really forces them to have to think and to make their own path as they move forward. And it's incredibly challenging, and it's very disorienting at first. But I found that it was, particularly given what I had just spent, you know, 5 or 6 years doing, which was being totally disoriented myself about what I was doing and where I was going and how I was figuring, but having to figure things out, having to make connections, having to draw on whatever skills you have, having to pull other people into your work. I had found myself professionally doing that, and then I saw these students doing something similar in their educational endeavor, and wheels began to click into place. That there was something more fundamental. It wasn't just my own experience. There's something more fundamental about how things work, particularly in environments that are not totally clear. And for a student, right, to design their own major, what does that even mean? How do you do that? I thought that's what the faculty are supposed to do. They're so smart, right? They tell me the path I follow, and then I just follow it. But if you really step back and think about it, that limits a certain kind of thinking and a certain kind of creativity. And I found that relationship between what I had seen happening in the world and the way that the education was modeled at Bennington, there was real resonance there. So that was another way in which I began to think deeply about how you structure things in a kind of open environment where it's not always clear what the path is, even if you have a general sense of where you're going. And then, in my last, right turn, 180-degree turn, whatever it is, I somehow found myself leaving the admissions world and entering the world of global health, about which I knew nothing. And here I was all over again. So I'm the Chief Program Officer now at Partners in Health. I imagine most of you know something about the organization, which was founded in the mid-'80s in Haiti by Dr. Paul Farmer, Mountains Beyond Mountains. How many have read the book? Pretty amazing. It's usually the case. He's quite an impressive person, and the organization is really quite an amazing organization. It is also the most complex organization I have ever seen in my entire life. It's just mind-blowing. So, in addition to having to learn about global health, I've been grappling with how you structure an organizational model that can take into account, an office in Boston with about 100 people, 8 sister organizations that work in different countries around the world, employing, collectively anywhere, depending on how you count it, 12 to 15,000 people, all in, radically different cultures, and working in close collaboration with Harvard Medical School and the Brigham and Women's Hospital, where we have deep institutional ties. We share payment for certain faculty who work in the field. We have residents that go out to the field. Like the institutions are deeply intertwined, which makes managing them incredibly difficult. Not to mention that they're academics and doctors, which is another set of challenges. And we work in about 70 health facilities around the world, none of which we own. They're all owned by our public sector partners, ministries of health, and governments in the countries that we work in. By design, that's very much our model, is to strengthen public health systems, because we believe that health is a human right, and a human right can't be conferred by a nonprofit organization. It has to be conferred by a government. So we don't control the clinics, really, and a lot of the staff in the clinics are ministry employees. They're not our employees, but they're doing the work that we're trying to do. And we're not really just working on a vertical thing. We're trying to essentially change the way the world delivers healthcare. So that should be fairly easy, right? Good thing I have that admissions experience. It definitely helps. So again, just, enormous complexity. I can't pretend like I have the answer. I certainly don't have it at PIH. I'm not sure it's there to be had. But the way that I find myself anchoring myself and getting some sense of balance and orientation is constantly looking for some of these principles that I'm going to try to talk to you a little bit more about now. So that's just by way of background to try to give you some justification for why it might make sense for me to talk to you for a few minutes. I don't know. You'll decide at the end whether it was. All right, so that's sort of my science fiction and my background. So emergence. When I was at Bennington, one of the things I did is I got involved in starting this center which was called the Center for the Advancement of Public Action. And that was an attempt by the president to really figure out how do we connect the liberal arts with public problem solving in a much deeper way. So, there's a lot of things around community service or service learning, there's study abroad, there's ways that colleges and universities have recognized that we've got to try to link what kids are learning back into reality in some way. And because Bennington has this open structure, there's more latitude to try to do that. And so she started this center, and I was involved in helping to conceptualize that, and then I was one of the first people to teach in the center. So for 4 years I taught in the center, mostly around issues of education reform. And as I was teaching, one of the things that I read with my students, we were constantly looking for things that were relevant to how we thought about education reform. And, I guess maybe because I'm a little nuts, we started reading about this biological concept of emergence. And I don't know how familiar you are with it, and I wrote down a definition because I won't possibly be able to remember it. But the standard definition of emergence in a biological sense is the arising of novel and coherent structures, patterns, and properties during the process of self-organization in complex systems. So if you could follow that. So examples would be, like an ant colony, right, where there's no central, conductor saying do this, do that. All the ants operate independently, but when you step back and look at the whole system, it has this incredible coherence to it, right? Like they have, some ant populations have graveyards, and they have, civilizations almost. It's sort of amazing. But there's no center. Human society or the internet would be another emergent structure, right? There's no central control, but there's a structure that begins to emerge out of this pattern. The swarming of birds or fish would be another example of these emergent patterns that unfold. And interestingly, the way I got introduced to it was through the artists at Bennington, who, as you can probably imagine, tend to be a lot more comfortable with the concept of uncertainty than other people, particularly people in the business world, I have found. Writers don't know where the novel's going. They just have to let it emerge. Painters often are playing and experimenting before their ideas take shape. And the person who I learned the most from was actually a dancer who taught improvisational dance. And she began to notice in her work that dancers, when she put them in, gave them some parameters, that certain patterns would emerge over and over. Even though they were improvising, right, there was no set pattern that they were being given, there were certain structures that began to repeat themselves. So she became fascinated by this idea of emergent improvisation. And so we began to read about this concept, and I got really interested in it. And I have found over the years that it's kind of a concept that I just go back to, because often what I find is that people get an idea of what the structure is that they want, and they're sort of determined to build it no matter what. And sometimes what happens is you have to just pay attention to the patterns that are emerging, and then quickly change to structure around those patterns, because those patterns tend to have more stability. There are often reasons why those patterns, and you have to make sure you know how to differentiate between a stable pattern that can help you structure and a dysfunction that has to do with human behavior, which is not so productive. That just takes experience. But there is something, I think, really profound about this idea of paying attention to structures that are stabilizing forces within complex systems. One way that I sometimes notice this coming out, so for example, I remember reading recently about Twitter's history, and they had a very different idea of what they thought they were doing when they first got started, and they kind of got stuck on that for a while, and it wasn't until they realized they were onto something else that, it took off. The Facebook is probably, a little bit similar, right? So, and you can sort of contrast that. So, I mean, not that this is perfectly true. Of course, no generalizations like this are. But I do think there are sort of differences between more, traditional models of management, kind of linear management, and this more emergent model of management that I'm talking about. So, I have a friend who runs a solar power business, and, they put solar panels on the rooftops of large like warehouse spaces that Walmart owns or that Target owns, and then they, have to, a certain amount of square footage generates a certain number of kilowatt hours, and it's pretty straightforward what the business is, and his work is really kind of the art of the deal. Like he just has to get it, he has to get all the pieces in place and then close the deal, and he makes money. Whereas what I'm trying to do at PIH, there's no deal I can close. I'm just trying to figure out how do we build a structure that isn't centralized, but takes into account all of these different things that we're doing, right? And that's a constant process of watching and observing and looking for those stable patterns. A couple of kind of guiding ideas that I have found to be really important, and so I'll just share them with you. I can't imagine that you haven't thought about these things yourself, but I'll just say them. One is the importance of information. So, all of you, I'm sure, are exhorted to think about, your impact and, evaluating your work, and, obviously funders care a lot about that. You should care a lot about that. That's very important. But it's a little different than information that helps you manage. Those are not always the same thing. I mean, obviously you're trying to manage to the long-term outcomes. But there was a great article recently in Time Magazine, a cover article by Stephen Brill. Did anybody see that? The Code Red. Did you read that article? Anybody? Okay, a few of you. It was really, really interesting article about the failure of the rollout of the Obamacare website. And the description of what happened kind of leading up to the launch of the website, I mean, total dysfunction, right? Nobody knew what was going on, really poor communications, not focusing on the right things. So that was a complex system where they were sort of not paying attention to the key elements. And so they brought in this crack team from outside, and one of the very first things they did was create a dashboard for themselves so that they had the most critical information in a very fast time frame so that they could constantly be evaluating where they were and where they were going. And they relied on that information to guide their decisions. So it wasn't about the smartest guy in the room or the guy with the title. It was about what's the information telling us, and whoever's sitting around the table and has an idea about how we're going to move it forward or is seeing things from their perspective can contribute, and we'll move it forward. It's a really fascinating article, I think, about when something when people give the right kind of structure in those sorts of environments, how it can accelerate success. And they turned it around. I mean, it's really quite a remarkable story. There were absolutely no guarantees that they would be able to succeed at that. And in an incredibly short amount of time, they were able to fix that and get it up and going. And, not that it's perfect, of course, but the second thing, in addition to information, is the idea of adaptation. So I kind of alluded to this a little bit earlier. But I think the need to kind of constantly be attentive to what's going on and be willing to shift gears a little bit. So again, just to kind of go back to some of my experiences, with community impact, bringing a model of a program into a community, being willing to move off the dime a little bit and, boil down what you're doing to what's fundamental to it. While sticking to your core values. At Bennington, watching students, stay adherent to a long-term view of where they're trying to go, but also be able to shift gears, to pay attention to what's happening to themselves educationally and say, that matters. That matters a lot. I'm going to kind of follow that. And that willingness to shift and adapt and change often leads in these unexpected and really productive directions. At PIH, similar kind of thing. We have sort of two kind of basic programmatic models. One is at the level of healthcare delivery itself. We sort of have this basic triangle picture of community, health center, hospital, right? So Paul will tell you that in any health system, that structure is very stable, and it's how you deliver good health care, don't care what it is. You start in the community, you start with where patients are, you identify and find cases. When you find them, particularly when you're working with the poorest and most vulnerable, you get them into a health clinic. Once they're in the health clinic, you can deal with most things. When you can't, you have to have a place to refer them to a higher level. A woman who's, obstructed in labor and has to have a C-section, let's say, just as an easy example, right? So if you have that basic system, you're going to really be able to take care. And then in an ideal world, you have a tertiary level as well. But that basic program model, you could drop that into any community here in, Rwanda, in Haiti, and it will essentially hold true. And then so that's a delivery model. And then we have our own programmatic model, which is really, direct service of the highest quality, leveraged always by teaching, research, and advocacy. So you can't just do the service delivery. You have to train people so that it becomes embedded in the system. And you have to do the research to generate knowledge about what you're doing so that you can share that, and leading to the last thing, to advocate for changes in the way the system is structured, changes in policy at the national or global level, right? So those two things, those are kind of bedrock frameworks for us that we use and can use anywhere. Where you use them, how you use them, what you emphasize within a particular setting will vary. But it allows you to kind of stay true. And then, like I said with community impact, the other thing that I found, really matters in this work is you have to have some underlying values about what you're trying to do. And for PIH, though, we're sort of, rife with values. Preferential option for the poor, making sure that we put them first all the time. Really thinking about questions of access, really thinking about the idea of proximity. So, it's always, answers always are going to come better from an implementation standpoint when you're close to the problem, because it feeds the way you think about what you're doing. And so as we're even trying to design, what sort of structure should we have in Boston, that question of proximity, what should we be doing there versus what should we be doing here, it's always on the edge of our mind. And that is really important because, again, it forces us to be adaptive with our structures. And then, so kind of to go along with that, what those things are for me are, like the plan process at Bennington, or the STAR model or the delivery model for PIH. They're frameworks. Excuse me. They're not roadmaps. They don't tell you, oh, this is exactly what you do. When you get this, you do boop, 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 boop. At a program level, it's so hard to lay those rules out. So, but having that general guidepost, right? If you're a student, knowing in year one, your job is to explore. I'm not going to tell you how to do that. I'm not going to tell you which courses to put together. I'm not going to tell you you have to take 3 here and 2 there and 1 there and you can choose within that. I'm going to say explore. But at least you know you're exploring, right? And then in year 2, I tell you, you have to start to narrow down and make some choices. And so you kind of know you're in that part of the structure. And same at PIH, you constantly know where you are in the structure, but you're always having to use your intelligence within that to try to make decisions about how to move forward. And I find that that idea of a framework, we've been working on a strategic plan, a 5-year strategic plan for PIH, again, trying to bring all these disparate partners and people and organizations together. And we can't just say, we're going to solve hepatitis C, right? Because that's a really big issue right now in global health. It's a huge global burden. There's a big gap in delivery on that, especially for the poor. But it's not relevant to everybody, right? Yet we need to be in a position to work on that. So how do you create a strategic plan that allows for that while still recognizing, that we need to strengthen our community health workers, in another part of the system? So trying to find a strategic plan model that's more of a framework and less of a roadmap has been part of the art of the management that we've been doing, sort of centrally, if you will, in Boston. Another really important, so information, adaptation, frameworks, and this isn't really like a thing you want to use, but you do have to be aware of it, and that is anxiety. So when you're managing in complexity and you're managing uncertainty, people don't like it. And organizations don't like it, right? People want to know, what's my job? Who do I report to? What am I going to be held accountable to? And those are all very understandable things. I feel those things too. And organizations don't like the uncertainty either. They want to know, we're definitely doing this and we're definitely doing that and here's how we do it and it's on this timeline and everything else be damned. I find again that sometimes that isn't the most helpful emotion, but it's there and it's there all the time and it causes really bad behavior. And so it's, I think most of all, something you just have to be aware of. You have to be constantly mindful that it's there. You have to not try to, stop it completely, but in being aware of it, you can think about how to deal with it. And I have found over and over again that a big part of managing in these environments is to figure out how to deal with that kind of uncertainty. People can deal with a certain amount of it. They can tolerate a certain amount of it if they know that's part of the game, right? So we're always going to be structuring a little bit. It's okay that we're restructuring as we move forward, because that's part of the nature of this organization. It's part of how we're going to move forward. Remember, here's where you are in the process. It's okay. It's okay to feel uncertain. People can keep, accepting that, but it does require attention to make sure that you are supporting people as they move through these things. And you just have to watch out for the downside on that. The other thing with anxiety, and this is true, I have also found as a general matter in complex environments, and you'll also see this in the Stephen Brill argument, is you really need good conversational structures. Like, how are people talking to each other and when? Conversation is one of the most important things to solving problems and to recognizing emergent things, because it's only in talking with other people that you kind of figure these things out. You rarely are just going to sit in a room and design it by yourself. You have to talk to each other, and you need structures that allow you to do that and to respond to what's going on. So then one other thing I wanted to mention, the last thing I wanted to mention, seems super obvious, but I find amazingly that it's not always thought about as well as it should be, and that is revenue. So I hardly need to tell people in this room who work in this space that the nonprofit or social sector market is totally inefficient, right? In the business world, your customer pays for your service, and if your service stinks, they don't buy the product and you go out of business. In the nonprofit sector, or the reverse, obviously. In the nonprofit sector, you have two masters, right? The people you serve are not the people who pay. And so you're constantly trying to do both things, and you can sort of imagine, generally speaking, who wins that battle. And so because of the inefficiency of that financial market, the whole question of sustainability is always front and center. And I think we make a mistake when we try to think perfectly about nonprofits as businesses, because they're not. But they are, in the sense that they have to think always, always, always about revenue. And the organizations that I've been involved with that have failed, or that I've advised that have struggled or failed, have generally not been able to get over the revenue hump. And so I guess, I don't have an answer to this, except to say that I think it's something you should be thinking about every day and from the beginning if you're starting something. The difference between coming from the nonprofit world at Community Impact, where we ran a kind of small community-based program and we essentially had to start over every year, to Bennington, where 70 to 80% of our budget was on earned revenue, tuition, was like, oh my God, this is fabulous. We only have to fundraise a small amount. Even at Partners in Health, it's a complicated thing to think about there. But because our strategy is a public sector strategy and we work in collaboration with government, there's a way in which we're building into the existing system the services and the approaches that we take, which creates a kind of sustainability because we're building it into that system. We're thinking about public insurance mechanisms for the poor is a way of figuring out how to generate revenue in the system. Because if you just have to raise money for it philanthropically over and over again, it's a trap you can almost never get out of. Eventually, that fuse burns down. And so, again, I don't have an answer, but I think, trying to understand whether you have kind of a business component that could generate revenue, like a museum or a university or other fee-based kinds of models, or whether you maybe go, which is maybe more like a straight business where it's transactional, or whether you have some kind of public strategy where you're embedding in public systems. City Year is a great example of an organization that had a great program design, and they had a fantastic public sector strategy, and AmeriCorps came out of the City Year model, and now is available to people all over the country, and it's a great model. City Year itself as an organization still has to do the fundraising thing, but they get a lot of their money through this public sector stream. So again, very effective at thinking about Teach for America, similar kind of thing. Teacher salaries paid by the public sector, boiling down what you have to do to the kind of training and recruitment side of it. All right, so I promised I'd get to the Sierra Madre. I have no idea how I'm doing on time. The light hasn't flashed yet, so I'm assuming I'm okay. I guess the last thing I wanted to say was just, I was in Mexico, in Chiapas, where we have a small site, about 10 days ago. And it was really interesting that the Mexican system is obviously more mature. The economy in Mexico is more mature than it is in, say, Malawi. And they have a public health insurance, national public health insurance. It's Seguro Popular or something like that. And so there's just a stronger system there, but the poverty is still very real. And in the places we work, typically for PIH, it's not so much about just working in the poorest countries, but it's about working with the poorest people, the people who have the least access to any health system, which, by the way, we face as much of a problem here as we do in other parts of the world. It's really quite striking. And we have a program out on the Navajo Nation. We've been having conversations about doing some work in some of the southern states where the health disparities are really just mind-blowing. So in any case, in Mexico, they have this structure for training doctors in which the state pays for students to go to medical school. Amazing. And in return for that, the medical students have to give a year of service afterwards. They're usually stuck out in some remote clinic in the middle of nowhere with no support. So they have no clinical experience because they've just been in school for the most part, and they're stuck in these little health centers with the poorest people. It's sort of a disaster. And so what we've done, what our program has done, is we've sort of latched onto that public structure, and we have provided training for those pasantes, they're called, during that year. And we bring residents from the U.S. down who sit with them and do a variety of training with them throughout that year. And we network them together and kind of help build their skills. And needless to say, it's become incredibly popular, and all the doctors at some of the best medical schools are dying to get into this program. And when I was there, we went with this young doctor who had just finished her year of social service and had joined the organization to help patients navigate the complexities of the Mexican system. And we were sitting in this man's house. He was a patient of hers, and he'd had some complexity, about 70 years old, and he'd had some complexity with his health issues. And she visited him on a regular basis, and she could tell that he was really not himself, kind of sad. And we sat there for an hour. And she just sat in this little wooden chair, kind of dirt floor, and she just, touched his arm. She just said, you don't seem that happy. Like, what's going on? And it was really a miraculous thing to watch. And as the conversation went on, he kind of got a little teary at one point, and he was just afraid he was going to die. I mean, that's really what it came down to. And she kind of pepped him up, and she reminded him about how important it is to be active and some things he could do with his treatment. And as I sat there and watched this interaction, I thought, as I often do in this work, the thing we can never forget is why we're doing it. We get really wrapped up in like the business models and the revenue and the sustainability and the emergence and the frameworks, and it all sounds great. But at the end of the day, we're trying to change the paradigm for people who are suffering, for people who are trying to find some way to work or to educate their kids or to have basic health care. And so, in all of this, the thing that matters most is that. And so I hope, as you imagine the world as it should be in the way a great science fiction writer might, that you just never lose sight of that. So thank you very much. I don't know if anybody has any questions for me. That was pretty wide-ranging. Yeah.
Thank you very much for that great talk.
Sure.
I wonder if you could elaborate on the point you made about conversation structures. I've never heard that point, and it sounds fascinating.
Yeah. Again, this is something that I really thought a lot about and learned a lot about at Bennington. The president of Bennington, who, Elizabeth Coleman is her name, she gave a great TED Talk, by the way. You should look it up, about the liberal arts. It's fabulous. And she is, in my view, one of the great thinkers about education. And the insight that she taught me is that the classroom is a model for public action. And the classroom is a model for public action not because she's a teacher and has expertise and delivers it, right? Or if I'm a manager, I have expertise. I'm the chief program officer. I know what we're going to do. Like, here's the thing. But rather to get people in a room together, each of whom brings their set of experiences around shared, some shared content of some kind. We've read a book together, or as I think about translating that into the work environment, we're struggling with how to deal with the shortfalls in our Nurimamba production, our peanut butter paste in Haiti. How are we going to deal with that problem, right? We have this shared content that we're coming together with. And then you get that multiplicitous input. And my job as a teacher was very akin to my job as a manager, right? My job as a teacher was to listen to the conversation and say, well, that sounds really interesting. Say more about that. Or, earlier you said this, and why don't you pick up on that? Take that to a management structure, and what I'm listening for is, where are the ideas? Where are the good ideas? are there ways we could think differently about this rather than sort of bringing my lecture or my agenda to the table? And so, I don't know about you, but in my business experience, I spend a lot of time in meetings. And, one-on-one meetings tend to be fairly productive because there's something specific you're working on. But when you get into the bigger groups, it's like sometimes you just want to kill yourself. And so I think, really trying to figure out what those management structures are that are sort of conversational and allow you to continually think, adapt, rework are really important. And I am a big fan in blowing those structures up until you get them right. So I don't know if that helps. Yeah.
You actually did a great job bringing clarity to my chaotic experiences over the past couple of years, so fantastic.
Good.
But you said something that really struck a chord, resonated with me, and that is being able to distinguish between unstable versus stable, and you said it only comes with experience.
Yeah.
But can you at least elaborate on your experience as to how you could tell that this is clearly a dysfunctional, unstable chaos versus this kind of chaos?
No, it's a great question. It's such a hard one to answer. Did everybody hear the question?
No. Could you repeat it?
Sure. So the question was my comment about being able to differentiate between sort of too chaotic and a kind of stable structures and bad structures. How do you, if we only get that through experience, how do we learn to recognize that? I think, boy, that's hard. I think that what I have found is that I recognize it the most in the way people respond to the structure. So when there's persistent dissatisfaction and unhappiness, you can pick up on that and you realize, okay, well, I don't have it yet. And so I'll give you two examples. So again, to sort of use the educational model as a way to kind of think about this, right? A student who was struggling in the design of their major, you could really tell the difference between the kids that were on a good track and kids that weren't. The kids that weren't, it was too chaotic. They weren't making connections, they weren't figuring out how to pull things together, and often there were sort of elements missing. Sometimes it was just inherent to the way they approached it. Often it had to do with the fact that they weren't, connecting adequately with an adult who could help give them some guidance and so forth. But when the students had it, you could just see there was a confidence and a character that they had about. They didn't know where they were going, but man, were they excited about the path they were on. And I found that stable structures tend to display a similar, behavior or pattern in a work environment. When I first got to PIH, the organization had been through incredible disruption, right? So 10 years ago, PIH was a $10 million organization, less, I think. And now we're just under $100 million. So exponential growth over a decade, combined with the financial crisis in 2008, combined with the earthquake in Haiti in 2010, which was a catastrophe, not just for our patients and our doctors and our employees, but organizationally, it just had took this incredibly huge toll on us. So you kind of put all that together, and there'd been some turnover of senior people, and it was really chaotic, and you could tell that people just they weren't cohering. And so a big part of what we are continuing to do and have been doing is trying to define certain things and create conversational structures and clarify different kinds of roles and different ways we interact with each other. And you never get it right. Another little thing I have is sort of the rule of 3. So you almost never get something right the first time, right? But it's critical that you try it, and then you have to iterate and you have to iterate. So like with this strategic plan, we've never had a plan quite like this before. And people are like, it's not going to work. I don't like it. I don't own it. It's not mine. My voice isn't in there. I don't see how I fit. But I know enough to know that it's representative enough of everybody and all of our wide partnership that it's going to move us forward. And then what I know is I have to build the right structures to put us in conversation with each other over time, so that people see that it's not about me trying to dictate a plan to partners in health, Mr. PhD complet guy, but rather me, trying to organize and orchestrate a structure. Next year will be better. We'll sharpen, we'll identify, we'll prune, and then by year 3, we're going to be running. So it's, I think you start to know it when you see it, and I think you see it in the way people behave.